Hi, I'm Morse, the founder of Core Elements Training. In this video, we're going to demonstrate vacuum cupping and thread the needle stretch. Applying the vacuum cups whilst the client is doing a functional stretch is a great way of increasing range of motion, helping to reduce muscular-related pain and tension, and helping to increase nutrient content and blood flow to the muscle tissue, all of which is going to help to reduce pain and increase tissue health. But whilst doing the cups in a functional stretch, this is also going to help to increase functional range of motion as well. The thread the needle stretch is a great way of helping to increase flexibility in the rotation or the spinal rotation movement. Okay, so we need to apply the cups when our client, who's Katie today, is in the tabletop position. So Katie's going to come onto the couch on all fours. Okay, and then we're just going to move the clothing so that we can place the cups on. So we want to make sure that we're adjusting the clothing so that we can get to the erector spinae group. Now, thread the needle is going to be full spinal rotation. So we want to place the cups in the lumbar region, but if we have the option to, we want to place some cups around the thoracic region as well. Okay, so I'm just going to lower that down very slightly here so we can get to the sacrum area. Now I'm going to use lotion today. It doesn't matter what type of medium you use, but even though we're doing a stretching technique, the client still needs to have medium on the tissue because the cups will move. So the lotion I've got in here is the Physique lotion, but you could use wax and you could use oil as well. So whatever you normally use within your clinic. Okay, so I'm going to apply the medium to the area. Okay. Now the medium doesn't need to be fully absorbed. Obviously you can spend more time warming up the tissue. You can spend more time doing your massage techniques here. Okay, so we've got that medium base on. Okay, and now I'm going to apply the cups. So the cups that I'm using here are the vacuum cups. These are Dongbang cups, but they're a vacuum cup. So you know that it's a vacuum because you've got the pump here. So I'm placing the cup onto the erector spinae group, just near to the sacrum area here. Okay, and then we can see the lift coming up into the tissue. We want the cups to be around the erector spinae area because we want that muscular release. Okay, and we want to help to increase range of motion. Okay, and range of motion on that rotation. Okay, now I'm coming just above here into the thoracic region. Just going to work around the clothing area. So I've got the cups on one side, but now I'm going to place the same cups onto the other side as well. Okay, so as we're adjusting the amount of pressure in the cups based on your client's tolerance. Okay, Katie's quite used to having cupping, so I'm placing roughly about 1.5 to 2 pumps into each of these cups. Now sometimes when we start moving, the cups may come off. That's absolutely fine. We can still continue with that movement even if 1 or 2 has come off. Okay, but before Katie moves into thread the needle stretch, I'm just touching each of these cups to make sure they've got a nice firm seal. Okay, then Katie's going to move into thread the needle stretch, which is spinal rotation. We're just going down as far as the client can go. We're going to use this a bit more like a dynamic stretch. So she's coming back to that tabletop position and then she's coming back over into that stretch. Excellent, coming back up. She's going to do that 3 to 6 times on each side. So that's that third time. As Katie goes into the stretch, we can see that the tissue is stretching inside the cups and we're looking for the colour coming into the cups as well. Now Katie's going to come over onto the other side. So it's up to you how the client does this stretch, whether they do one side first, 3 to 6 times, and then they go over onto the other side. Or they could go one side. So if you do that arm first, so come over, and then they might go over onto the other side. Okay, so we focused on that dynamic movement first, so coming into the stretch, coming out of the stretch, going into the stretch, coming out of the stretch. But on that final round as well, we could hold that stretch position. So here, as long as the client is comfortable and Katie's comfortable in this position, she can hold this stretch for about 10, 15, or even 20 seconds, just allowing that stretch reflex within these cups to kick in. At first, the first couple of movements might feel quite strong for the client. They might not get that full range. But as the tissue relaxes and as that stretch kicks in, it's going to feel more comfortable for the client, and they might get a larger range of movement. Okay, and then if you come back into that center position, Katie, and then just over onto that other side. Perfect. Okay, and they might find, and especially if your client is suffering with restricted movement on one side of the back compared to the other side of the back, they might find that that stretch feels stronger in one of those directions, and that's absolutely normal. Okay, so just to recap, if you come back into that tabletop position for me, please. We have applied the medium, so we've completed thread the needle stretch, or eye of the needle as it's sometimes known, which is a spinal rotation stretch using those vacuum cups. We placed the medium onto the skin first. We applied the cups. So remember, the more cups you're using, the stronger it's going to feel for your client. So we could have used 1 or 2 slightly less cups here and achieved a nice stretch. We've manipulated the amount of suction that we've put into the cups as well, to make sure that it doesn't feel too strong for the client. So we're working within the client's zone of tolerance. And then we're completed 3 to 6 repetitions of that thread the needle stretch using that dynamic stretch, and then holding it in a static position at the end.